And before we get into that merger and an update of that merger, why don't you give us some information so that our audience might understand exactly the population that Metro General serves and the importance and the influence of that institution.
Yeah, that's very important. And let me go back for just a minute to 1948. In 1948, Meharry Hubbard Hospital was, as now, serving a large percentage of poor patients. It's always been located, as you know, in the inner city. The majority of its patients have always been black and poor. In 1948, the number and percentage of patients at Hubbard Hospital who couldn't pay for their care was so great until it created such a financial burden for Meharry that the board voted to close Hubbard Hospital. The next day, the city council came into emergency session and out of concern for the closing of Hubbard Hospital. And they passed a resolution saying that Meharry Hubbard Hospital was so important to this community in taking care of indigent patients that it asked the Board of Trustees of Meharry not to close it and promised in 1948 that if Meharry kept Hubbard Hospital open, the city would reimburse Meharry for the care of indigent patients. Now, Nashville General Hospital, which has been there since the early 1920s, was the city's hospital for indigent care, but such a large percentage of indigent patients were taken care of by Hubbard until the city council asked that it not be closed and said the city would reimburse Meharry. The city has never fully lived up to that commitment. Now, there have been years, like the early 1970s, when the city has reimbursed Meharry for almost 1/3 of the indigent care provided. But other years, like the last 3 years, when it has provided no support. So, with all of that background, you know, you look at General Hospital, it's an old, dilapidated facility. Even in the early 70s, they were talking about the need to rebuild it. And they estimated then that it would cost $40 million to rebuild. We estimate today that it would cost easily $80 to $100 million to rebuild General Hospital. So we thought, just logically speaking, you know, Meharry has a very modern facility, completed in the late 80s, over 400 beds. It's not fully utilized. It provides care to the indigents just as General does. So we proposed in the late 1988 that the city, as opposed to rebuilding General Hospital at a cost of almost $100 million, close that facility and provide all of this indigent care through Meharry Hubbard. It would save the city the cost of rebuilding General. It would provide more services. Meharry has family medicine and preventive medicine that General does not have. Meharry has mental health care that General does not have. Meharry has dentistry. General does not have any of those things. And all of those are needed in the healthcare system. So it would give a building that's very modern. It would give services that are not there. And we found out later, because we didn't know this when we first made the proposal, we found out that it would also save in the cost of operation. It really would be cheaper to operate.
So the merger would make sense in a real sense. Well, now, let's talk about the introduction and some of the early opposition to that merger. And why do you think that, in view of all of the positive things that could come out of this merger, why do you think that some of the people are in opposition to it? And what were some of the your experiences before the recent update that we want you to give us?
Well, let me say this. We first announced the proposal at a Rotary Club meeting in November of 1988. I think about that because I was just at the Rotary Club yesterday. We thought that was a good setting. The business leaders in the community was there. The press was there. And we decided to announce at that setting that we were going to introduce this merger. And we explained the history that I just gave you and other things as to why we were doing it. We knew that there would be problems, and because there are a lot of barriers. There are social, economic barriers. There are area barriers. There's some people who are not comfortable in East Nashville, other people not comfortable in North Nashville. So this community has to deal with a lot of barriers, artificial barriers, have no business in existence, but they still exist. And we knew that in order for this merger to succeed, we were going to have to put those things on the table. Race is a kind of barrier because there are still people who think of Meharry as a, quote, black institution, when in fact Meharry is probably the more integrated institution, certainly one of the more integrated health professional schools in the country, integrated in administration and faculty, even in student body. But the people in this community still think of it as a black hospital, a black institution. We knew we had to overcome all of that. And I think we've had to deal with all of those issues. We've had to deal with people who are afraid to come to North Nashville, who think that it's less secure, when the fact is that their Meharry Fisk campus are more secure than Vanderbilt. That's been demonstrated by statistics, that there are fewer acts of violence per capita on those two campuses than on Vanderbilt's campus. And yet the attitude of people in this community is to think of a lack of security when they think of North Nashville. So we had to overcome all of that. We had to overcome people saying, well, how am I going to get there? Just like Reverend Reason led the homeless march. We've been able to show very clearly that transportation will not be a problem. We've been able to show that the two hospitals basically serve the same census tracts, the same patient population, and therefore we've had to deal with these barriers one at a time. The real barrier, the first one was financial, and because there were people who argued whether in fact it was financially feasible. The board's own task force showed that it was. The Ernst & Young report showed that it was. More recently, the mayor's task force. All three have showed consistently that it's financially feasible.
Very good. And so within that framework, you introduced the measure in 1988. The council had an opportunity, that is the Metro Council had an opportunity to debate that, and it failed the first time around, did it not?
Well, the Metro Council has not yet debated
I'm sorry, I mean the
Board of
Hospitals.
The Board of Hospitals, first thing they did was to appoint a task force, its own members. They have 7 members on the board. They appointed 4 of them as task force. 3 of them, after reviewing it, voted that the city should move forward. 1 abstained. It was after that that they got Ernst & Young to look at the financial feasibility. The board has resisted. There's some members on the board, including, I guess, the chairman, who have been resistant since the beginning and have used a lot of techniques to delay. And finally, in a split vote in February of '91, voted against it, saying that the major concern was whether Meharry could recruit the added faculty that it would need to recruit. And as you know, since that time, we've answered that question by entering into a joint memorandum of understanding with the Department of Health and Human Services, Public Health Service, to provide those physicians.
And so recently you gave a report to several committees, I think, at least emphasizing this new arrangement that you're thinking about, that you think will play a very, very important part in helping to bring the merger around. And I think one of the things that we'd like to talk about, Dr. Satcher, is something that you've already mentioned, and that is the integration of Meharry's faculty and its administration and its student body, because I think that plays a very, very important part, as you've already mentioned, in terms of people's perception of Meharry being, quote, a black institution. Of course it is an historically black institution, but at the same time it is, as you indicated. And I'd like for you to give us more information in reference to that.
Yeah, you know, I've always felt very strongly that if integration in this country is going to work, historically white institutions and historically black institutions both must be valued for what they bring to the table and what they have to offer. And Meharry is a private institution but has taken integration very seriously. As I said, we're integrated in our administration. 2 of my vice presidents are white, 2 are black. We're integrated in faculty. We're integrated in student body. About 75% of Meharry students are African American or black. About 15% are Caucasian or white, and the rest are a mixture of Hispanic and Native Americans. One of the things that this nation has acknowledged as a major problem is the underrepresentation of blacks in the health profession. So we intentionally keep the percentage of black students high because that's where the need is greatest. But we have a very integrated student body, a very integrated faculty, very integrated administration, and have had it for many years.
Very good. Now let's look at this merger update, Dr. Satcher, that because I think we will do this within the framework of both the Nashville Banner and the Tennessean, 2 of the most influential newspapers, as well as the Nashville Pride and the Metropolitan Time, all have in one way or the other endorsed the merger. And I think the new mayor, Mr. Bredesen, has said that he's in favor of it. As a matter of fact, I think he's predicted that it should occur by next spring. But I think that he's also concerned in terms of how it will be monitored and whether or not the business community can give the adequate kind of support. Now, what are you finding among businessmen in reference to this merger? I mean, do you find that there's latent support or no support at all, or do you think that they really don't? Well, how do you see that?
I think the business community